not all the joints have the responsibility of mobility. Sacroiliac joint is a stabilizer joint. The second group say there is a minimal mobility. The human being have a lot of synergisty. If any action in those muscles happen, there will be some change in the sacroiliac joint mobility. The first group will come and say, how are we gonna assess it? This paper gives a great shock for the people who used to assess the sacroiliac joint manually, right? So the sacroiliac joint in the eye of group A can be assessed only by provocation test, but by mobility testing, it's about impossible to be done. Okay? So, I took a response just like it was written in one of the lectures, or from one of the lectures given by Group B. And they said the following, exactly, what a mess. They tried to prove that the Rocklove test is not efficient for the calculation of the sacrum movement, while nobody ever claimed we used it to measure the sacrum movement. Rocklove is mainly used to measure the pelvic tilting. So the fight continues. What happened from the eye of Group B in that paper, that there was something called bias in selection criteria. What is meant by bias? تحيز. That's right. So bias in Arabic is تحيز. Okay? So there was تحيز in selection criteria. They choose to use a test to measure pelvic tilt to prove that it does not measure the sacral move. This image was taken from the paper, and they proved that we cannot assess the sacral move by that test. So the fight continues. Now, let's agree about something. If we continued to speak about that fight, we'll not go home. We stay here. Because every year, in a certain month, that fight starts globally. What is the truth? Now the question, Dr. Ramy, what is your point of view? Who wants to know my point of view in that? Raise your hand, please. Okay. Before I say my point of view, I will take yours. Can we assess the sacroiliac manually? The mobility, manually? Yes or no?
No.
No. What do you think?
I think yes. Yes.
What do you think? Yes. What do you think?
Yes.
Yes. What do you think?
No.
No. What do you think?
I'm stopping.
I'm stopping. Okay. What do you think?
Yes.
Yes. Okay. So, some people of you are Group B and some are Group A. So, the fight will continue. Now, let me say my opinion about that. From my point of view, first of all, there is no doubt about the assessing of the sacrum manually. The assessing of the mobility of the sacrum manually is impossible. I'm sorry for that. The assessing of the sacrum mobility manually is impossible. Now, you can know if it moves or not, but moves in which direction accurately? Sorry. The second thing, which with how many distance, حركة قد إيه? You cannot say. Manually, it's impossible. I'm sorry for that. The second thing, the assessment of the sacroiliac joint, the testing of the sacroiliac joint is very subjective. Now, for example, we have the famous standing flexion test. Dr. Muhammad Salah, stand up. Dr. عمرو, انت عارف standing flexion test? Okay, اعملوا لمحمد صلاح. Standing flexion test. Okay, I will do it. اقف اديني ظهرك. اديني ظهرك. Now, they say that if I put my hands on the posterior superior iliac spine, right and left, خلاص. وطي. تسلم ايدك يا دكتور. تسلم ايدك. Now, the part which will move anteriorly will have the dysfunction. Now, it's subjective because I can do it and it will be right, and Dr. Am may do it and it comes left. Right? Another way, لما اعمل standing flexion test دي بيقولوا I'm sorry, I will translate. بيقولوا ان الناحية اليمين لو اتحركت يبقى ده side of dysfunction. It's subjective because I may خلاص اقف. I may do it and I will say right and Dr. Am will say left. Or they say that the standing flexion test shows that the ilium have the problem. The sitting flexion test, if the part moves more, so the sacrum will be the problem. It will be less, so it will be the ilium. Again? So the sitting flexion test, if we put both our hands and it moves right more than standing, so the sacrum have the dysfunction. If in standing I did and moves more in standing, so it will be the ilium. So I can show that it's more in sitting and Dr. Amir can show it's more in standing. So what is that? It's subjectivity. Thank you. Subjectivity is what? It's counting on the hands of the practitioner. It's not objective. We cannot have numbers from it. Okay? Now, that's the second point. So the first point is the following. That it's impossible to assess the sacrum mobility manually. The second point, it's impossible to assess. I'm sorry, the first is impossible to assess the sacrum mobility manually. Okay, now the first point again, it's impossible to assess the sacrum mobility manually. The second point is the assessment of the sacroiliac joint is very subjective. The tests of the sacroiliac joint is very subjective. The third point is that there is no specific exercise isolated for the sacroiliac joint. So you know the major moves of the sacroiliac joint. This is nutation and this is counter nutation. So if you please nutate the sacrum without moving the lumbar or the hip. It's impossible. Can we do a specific exercise for the sacrum in nutation and counter nutation without doing lordosis or kyphosis or flexion or extension in the hip? That's impossible. Right? So, let me continue. Now, those are the 3 points I want to say, and there is a fourth point. Yes, the sacroiliac joint is rarely, very rare, to be the origin of a musculoskeletal complaint. Very rare. I know that some of you have heard that if any musculoskeletal patient came to you, work on the sacroiliac joint. I know that. But honestly, the sacroiliac joint is rarely, very rare, to be the origin of a musculoskeletal complaint. Okay? Now, this is true. So who wins, Group A or Group B? Sorry, Group A does not win. Why? Because there is a continuation for the information. Now, I have to tell you something, that the sacroiliac joint researchers are not enough to decide. Responding for the first point, the sacroiliac joint mobility is very hard. And I'm sorry, is impossible to be assessed manually, right? But its position can be assessed manually. So, the point is, try to assess the sacrum from a non-loaded static position, which is prone. That the patient lies down and you palpate S1. Now, doctor, the sacroiliac joint only moves 2 millimeters. Only 2 millimeters. That's right. How the musculoskeletal dysfunction happens? The musculoskeletal dysfunction happens if a joint or a bone in the joint prefers to be located in one part rather than the others. So, if the sacrum prefers to come side nutation, like that way, and looked in that position, the body will react accordingly. Right? The body will have problems. So if the sacrum is looked in that position, we can assist the part or the area that is looked in that position manually. So nobody have ever claimed that we should assist the mobility of the sacrum manually. That's impossible. We are not assessing the sacrum mobility manually. We are assessing its position. Agreed? So that's the response for the first point. Okay? متفقين يا ولاد؟ The second point is the following. The sacroiliac joint testing is very subjective. I agree. Yes, it's very subjective. This is why we are not satisfied by only one test. We're doing 1, 2, 3, 4, 5 tests. So if the first one is subjective, the second one will show how much it's subjective. So we have the standing flexion test to know the side of the dysfunction. Then the visceral inhibition to prevent the visceral effect on the sacroiliac joint. To prevent the visceral effect on the sacroiliac joint. That's how the viscera is located, especially the pelvic organs, is located directly under the sacrum. So if there is hypertrophy in some organ, the sacrum will come in counter-nutation. If there is adhesions, it will come in nutation. Okay? So all of those tests, standing flexion test, visceral inhibition, sitting flexion test, Gillette, all of those tests to ensure the objectivity of the assessment. So if in one test it comes right, in the other it came left, so my hands are not accurate. I need to practice more. You understand me? Now, to increase the sensitivity of any manual testing, we have to do multi-testing, right? You have to do the tests by many other maneuvers, many other ways. You got me? So, the second point, to avoid the subjectivity, make more tests. The first point, sacroiliac joint mobility, is impossible to be assessed manually, but its position isn't. Now, if the sacrum moves only 2 millimeters, how many paper, excuse me, I'm so sorry, how many paper thickness you think it's 2 millimeters? 2 millimeters, 20 paper thickness. So the difference between one side and the other will be 20 paper thickness. Now, the problem is, if it moves 2 milli from the right, it will come back 2 milli from the left. So the difference will be how many millis? 4 millimeters, which is 40 paper difference. So if you manage to make the patient lie prone, and you took your time and you had the experienced hand, you will be able to know the position of the sacrum accurately, right? Okay. Are you focused with me? Okay? Now, the third point that we discussed is the following. There is no specific exercise for the sacroiliac joint. Right? Right? Yes, there is no. This is why manual is vital for it. This is why manual therapy is vital for the sacrum. Because without the manual therapy, you will not be able to work directly on the sacrum. But doctor, the last point you said is that the sacrum is rarely the origin of a musculoskeletal complication, right? Yes, that's right. But it's always a link. It always link from distal to proximal or proximal to distal. Always link from the trunk to the lower limbs or from the lower limbs to the trunk. So, group A and group B are right. Both of them are right. What I want to prove now is that if you need to study something, you have to be neutral. You have to be what? Neutral.